in the past has played. So Isabel's here. And then Kim, I think you were at our last meeting, right? Kim Yee. And Kim will be sharing some work with us later in the meeting. Are you ready to do roll call, Isabel? Or whoever's doing it?
Sure, I will call out the names. I will apologize if I mispronounce anyone's name, and please correct me. So again, hi, I'm Mimi. I'm just delighted to be here. Very excited for my first community engagement and communications committee meeting. So I will call out, although I know she is not here, Michelle Glass, I know was not able to make it. Amy Fellows.
Here.
Thank you. Grace Hokog. Mickey Dirting. Juan Pablo Villalobos Garcia.
Here.
Hello. Colin Stackhouse.
Here.
Hello. Max Brown told us he would be possibly an hour late. And then Jacinta Hawkins.
Here.
And could you pronounce your first name for me so I don't mess it up?
It's Jensina.
Thanks. I was so not even close. Thank you, Jensina.
No problem.
That's phonetically here. All right. Jay
Jay just came in. Yeah, so maybe circle back.
Great.
They might be audio connect.
It's great. John Buzzard.
Here.
Thank you. Craig Newton. Juana Yesenia Hernandez Solis.
Here.
Hello. Jocelyn Ogden. And then we'll just check again. Jay Brown.
Present.
Hello. Thank you. Okay.
All right, I think we have a tech check slide up next. Just to remind everybody about the interpretation, set your interpretation button to the language that you would like to hear things in. And it looks like everybody's video is off. I don't know if that's from when you came in the room, but if you would like to have your video on, you can put it on and then just stay muted when you're not speaking. Oh, we do have interpretation today. I think that was from our last meeting when there was one time when there was the interpreter wasn't available or something. So yes, we do have interpretation today, and please set your interpretation button to either English or Spanish. And an agenda review. Executive Director McConnell Mimi is going to be talking about the Universal Health Plan Governance Board pause procedure. And then we'll be sharing together some updates from our strategic planning report back. And I know that Colin also was there as an observer. So welcome any thoughts you have, Colin. And I'm not sure if anyone else on the committee was watching online. That was kind of hard to track that day. But anyone who listened in, please, would love to hear your thoughts from the committee. And then committee update review and updating the committee work plan and timeline. An update on our consultants, Diane Bianco and Patty Wentz. And then Kim, I'm very excited, has done some work on starting a universal health plan style guide so that we can build that and make sure that all of our communications are speaking to the same thing. And then we will have committee member updates. So if there's any events coming up or since our last meeting that you have been involved with that you spoke about universal health plan or something coming up, then please let us know. And then we'll have our meeting reflections and future topics and end with public comment. Next slide. All right. Executive
Alrighty.
Director McConnell.
Thanks everyone. So what I'd like to do, I'm not sure if people have had the opportunity to take a look yet at the pause procedure that was sort of developed by the governance board. So I'll just share my screen. I won't make people, I will not read this out loud. However, the pause procedure is something that, and apologies, it's probably a little small, was developed, I think, Board Vice Chair Judy Richardson brought it up, and as just sort of guidelines for being able to possibly take down the tenor or the tone of a meeting if it's kind of getting emotionally charged or heated. And it really allows anyone who's attending the meeting to make a request to say that I would like, or, you know, I believe this conversation, we could pause this either for reflection or that the discussion is becoming unproductive. And essentially, it really is the opportunity for anyone, either for oneself or for the group. And you don't have to be the person involved in the conversation. Literally raise your hand and you could say point of order, or you could just say, I would like us to pause. And then the person who's chairing the meeting would say, all right, we are going to take a pause. And maybe if they feel like it, make a little comment, come back in 2 minutes or whatever the timeline they feel is appropriate. And then of course, later on, there probably will be a follow-up discussion like, okay, well, what was going on, to kind of do a little bit of debrief, but mostly it's just sort of in that moment. I think that, and it's a useful tool. So this is not like a state guideline or anything, but it was developed or has been used in other places, and the board developed this. And I think that it is, they asked for it to be shared with the committees. So I don't know, Amy, did you have anything else that you wanted to share about that?
I don't think so. Just would be interested in people's thoughts or if there's any questions. Yeah, Jensina.
Okay.
I think I'm mostly confused as to why this came up. Was there something that was perceived as an issue where we needed to have this in mind?
That is a great question, which I don't know that I have the
think-
answer to
I
it.
think-
You're sort of like,
I think there
help me out,
was a
Amy.
slightly heated board meeting. I don't think this is a reflection on any of the committees.
Oh, okay.
That was prior to Mimi joining. And so I think other board members kind of saw a need just, you know,
Thank you, Amy.
to do our work together. But then it makes sense to have the same kind of guidelines for all the committees, but we haven't had any heated communication meetings, I don't believe. Any other questions or comments on that? Okay, and then I think Mimi and I are kind of gonna tag team updating you all on our May strategic planning meeting. We met for almost a full day. I think it was 9 to 2. Everyone was in person at the State Library, which was a nice venue.
Oops. Let's see. So
And then
yeah, I thought,
yeah,
so,
I'll
oh,
let,
I apologize, Amy.
no, I was just
Yeah,
gonna say,
I
yeah,
just,
Mimi, if you can go ahead and then I'll fill in, sorry. Go
yeah,
ahead.
that sounds good. Yes, I will do the black and white. You can give the color commentary, as I said. So just some of the takeaways from the strategic planning meeting that, so the group got together, reviewed core principles, and did some work around a mission statement, which that work is still going to be in process. And I think we'll be coming back through this group here. Judy Richardson has an amazing talent and skill as a graphic facilitator. So I don't I wish I could describe it very well, but anyway, using those tools, literally sort of drawing on a giant piece of paper on sort of the state of healthcare. So, which, as we know, maybe not where we want to be. Then, of course, working with the board members to envision this future state, which I think many of us, you all have done tons of work on that. And then the process steps and also what they call the stepping stones that are parts along the way to get to that future state. And I think one of the things that was called out in the meeting is that these stepping stones are, again, like sort of discrete items on the way to the final ultimate goal, but they can also be enacted prior to everything possibly being completely changed. So, for example, I think one that for people who have been involved in providing healthcare or working in offices, having a single set of quality metrics as opposed to, you know, depending on the number of different insurers or things, you could have 10, literally dozens of quality metrics, more than that, and they're all a little bit slightly different. So something like that, all right, like within Oregon, there'll be a single set of quality metrics that are used to take some of the administrative burden off of clinics. Or another example would be global budgets for hospitals, which is something that has been a big discussion, not only at the Universal Health Plan, but in other aspects in Oregon. That would be another step where that would be as you all I'm sure are aware, that a lot of the cost increases frequently happen with inpatient care, either in hospitals or in skilled nursing facilities. So those are just two examples of things that the group talked about, and there were others that sort of could be standalone. Then there was also after that, I think we had lunch, I'm not sure. Then there was a discussion about like where decisions were made. And I think that because of the way, and Amy will definitely be able to help me out with this one, because of the way the board was developed and all sort of the work happening in the committees, I think that some of the questions that are coming up might be more suited to, after the, you know, making sure that the committees have input into it, but then some of the, you know, of course, the decisions are ultimately made at the board level, but in some of the having that process just being made a little bit more clear, I think is what they were talking about. And then because of, as you guys know, staff turnover and other things, there's been some of the timelines have been changed. And so they did some work on timeline updates. So that was my not particularly thrilling recap, but then I will let Amy, and also I hope Colin, because he was there as well, to describe more.
Yeah, I mean, I think that's a good recap. I wish we had a picture to show you all, and I don't know if there's a way to send out the picture of Judy's facilitated graphic artwork, which was really just amazing and very helpful for the process. We'll have to figure out if there's a way maybe to, I don't know, send a photo or something, Mimi.
Yeah,
I don't know.
I think there's some pictures on the actual the meeting website, the board meeting website. If you click on the meeting materials,
Oh,
there's
okay,
some
from
pictures.
our
There should be some
May,
pictures of it. Yeah.
on the May meeting materials. Okay, so yeah, I encourage you all to check that out. Maybe we can put something in the notes with that link so it's easy. Yeah, I think it was a really important day, I think, for the board just to really come together and have a longer length of time to really dig into some of these issues and get on the same page. So I found it personally very helpful. I don't know, Colin, as a observer that day, if you have any thoughts you want to share.
Yeah, sure. I was really glad that I went down, and I rarely leave a meeting, or I don't know, I don't attend too many like 5-hour long meetings where there's a strategic planning session with a whole pretty remarkable 10-foot wide diagram of like what the current status is and what the future has in store and the stepping stones we can get there. I guess, yeah, I've never been to a meeting like it, and I left really feeling pretty wowed by Judy's skills in facilitating the kind of conversation, and also like pretty pleased that the governance board would choose to spend their time sort of doing a big reset in this way with all this new staff and sort of like a new landscape for the next year and a half. It was great. I've listened into some governance board meetings that I ended the meeting and I did not say, wow, that was a great meeting, but this last meeting was really, really great.
Yeah, thank you. I don't know if folks have any questions or any other comments you want to ask. And yeah, I encourage you to, if you're interested, take a look. I know you probably don't want to watch a 5-hour meeting, but maybe especially seeing Judy's artwork might be helpful. Okay, if there's no other questions,
Okay.
I guess we'll move on to the committee updates.
Yes, let me just stop sharing. I gotta switch slides here. My apologies. Oh, there we go. And I promise by the end of the meeting, I will have some of those pictures and we'll share them when, when we get to the end for reflections. All right. So one of the, this is, as I said, this is my first chance to meet with this committee. Oops, sorry, I should have done it on a better view, but I'll make this a little bit smaller. One of the issues that I've heard from some of the committee members and board members as well is that communication could be better between committees, and so much of the work is integrated. And so it's been a challenge for, say, people on this committee, like, well, what is plan design and expenditure doing right now anyway? How, you know, what will we be able to communicate about if we don't know what the subject is? So one of my tasks is that I hope to do with the committees is, we'll talk this much usually, but just to bring to each committee sort of what the other committees are up to. So in that end, this is kind of brief, but I'll kind of talk to where the other ones are at. So the operations committee, just to kind of get that sense, you know, they're charged with developing a plan to how a public corporation would be created, and also a trust fund. So there has been a public corporation straw proposal after Kim Yi created some great documents and there was review, and that's actually been board approved. So there's work going on that way. The question about federal waivers, of course, is sort of in everyone's head. Our consultant team from HMA did a great report on federal waivers to the operations committee. You know, that question won't be, we'll never get to the end of that question, probably because things will keep changing, but it's still trying to get the baseline knowledge. And then there was a Treasury fund straw proposal that was reviewed at the committee. That's going to be sent to the board for final approval. And then I will just say, you know, within operations, this is definitely an iterative process. And so for our next operations meeting, some of those decisions will be discussed again with additional people to sort of hone in a little bit more with the colleagues from the Treasury Department and also the Department of Justice to talk about any of the regulations that might be involved in creating the trust fund and the public corporation. So that's operations committee. They do other things as well, but those are some of the highlights. Plan design and expenditures. They are working hard on the eligibility straw proposal, and that's really a priority, just to really very, very in a lot of detail describe who will be eligible for the plan, and with all kinds of things like, well, what if someone, you know, lives out of state but works in Oregon, or what if someone is only here part of the time? So there's lots of contingencies, so they are hard at work on that. There was a behavioral health straw proposal, which has been approved by the board. There's work around long-term services and supports that's still kind of in subcommittee in development. And then the large question of provider reimbursement, how in the universal health plan will how will the money be distributed? Will it be like the fee for service model? Will it be that some a more of a CCO type model. So that also is happening, and with a lot of, there's a subcommittee around that as well. Then lastly, finance and revenue. So how will how will this universal health plan of looking at with a new consultant group that's been brought on board, Echo Northwest are tremendous. They began working with the committee, and they have essentially lined out over the next 7 meetings, so essentially 7 months, not only reviewing kind of the status quo, but then bringing up all of the questions regarding how will this cost be equitably shared or distributed. And I just put in there that the committee is still also very interested in administrative costs. In other words, what is the burden, particularly on healthcare provider groups, for having, like I talked about, all of those quality metrics, for having to deal with all of the quality metrics, and how can we, how do we know what that burden is? Because if we know what that is and we know we can reduce it, then we would be able to ask less of the people of Oregon, would not have to pay as much. So that's the committee update. It was a lot. I'll just see if there's any questions. I promise I will not normally talk this much at your meetings. I apologize. And then I'm going to kind of combine this into a work plan review and timeline, and also talk about the consultants that you have, your amazing consultant group. So first off, just when people look at this, for everyone to know, this is always a draft, and this is kind of the state of the state as we see it right now. So kind of we have sort of the deliverables from this committee, and then 2025 and 2026. I just ended you all in July arbitrarily, just so you know. There's no major significance with that, but a lot of the work is going to happen before then. And what the main things that I think have been shifted around a little bit, probably because of staff turnover and other things, are kind of, I think Michelle, Amy, I think Michelle said like about 3 or 4 months, which I think is pretty accurate. So what you'll see is here I have in May and June under communication plan is that the style guide and that's really going to be, I think, the meat of this meeting that you all will be working on and developing, which I think is going to be a great exercise. Patty Wentz, who I think lots of people have either worked with her or certainly on the board level is going to be brought on board. We hope things will get finalized in June, but Patty Wentz will be working a lot with this committee on truly developing the communication plan, again, with input coming in from plan design and expenditure and things, so you guys have a better sense of what content. Patty Wentz will also actually be working with the board, kind of the same thing. Some of them, I think she's going to do some sort of like some training sessions about how to communicate effectively and appropriately. Diana Bianco, who I had the opportunity to meet, I think she's been to this committee before. Wow.
Yeah, they both have.
Oh my golly. Well, y'all are so lucky. So Diana Bianco, I met with her. She absolutely is still connected with this group. And it's just that the work that she is going to do with the engagement outreach plan is with those specific groups that were outlined in the Joint Task Force in Senate Bill 1089, and she is going to be creating those targeted, working with you all in creating those targeted presentations. One of the hopes for those is that then as the plan gets developed more and more, like provider payments or what are all of the benefits, whatever, that when she has those targeted presentations, there will be questions that can go to those specific groups. All right, provider groups, what do you think about this payment plan, this alternative payment model versus fee for service? So everything, as I said, is kind of been shifted a little bit later, but is still on track. So that was it. I am done and I'm going to stop sharing. But of course, any questions I'd be happy to take.
Any questions about the timeline, the work of the other committees? All right, y'all are quiet today. Hopefully you'll be get talking on this next piece. So I think we're ready for you, Kim, to share about the draft style guide and how this group can contribute.
Sure, thanks. Mimi or Isabel, whoever is in charge of today's slides, could you please pull up the section? There's one slide that talks about the goals of our discussion today. So if we could just cue that up, please. Thank you. There should be a slide, one slide after this that has suggested.
If there isn't, I'll go looking. You start talking, Kim, and I will go looking.
Thanks,
My
Mimi.
apologies.
Yeah, I put together a slide that had the potential goals for this. But hi, everyone. I'm Kim Yi. Thank you for letting me share with you today. Actually several months ago, there was some work happening in a different committee where multiple phrases were used throughout various committee meetings that gave your co-chair, Amy Fellows, pause, gave me pause, maybe gave other people in the room pause. And so it motivated me to approach co-chairs Fellows and Glass to ask them if this committee would be interested in developing what I like to call a style guide. So a guide that can be circulated throughout the entirety of all of the committees and the boards to help them standardize their language and the way that they speak about the universal health plan and the people impacted by the universal health plan in an appropriate and similar way. So hopefully you've all had the chance to browse either the English or Spanish language draft of the style guide in your meeting materials, which have been posted on the website. What I want for us to be able to do today is to think about several aspects of the style guide. So first, what are the gaps? What is the style guide missing? So what are specific words that, yes, Amy?
I'm just wondering, because I'm not sure if everybody did have a chance to review it before, if maybe you could, one of you could share your screen and kind of just get the lay of the land on what is a style
definitely.
guide and what are we talking about.
I
don't know if that would be helpful for others.
Totally. Yeah, I think the table of contents is actually a really good place to start with that. So
I will get there.
See a thumbs up for Mimi if you want to pull that up. Thanks, Mimi. So Mimi's going to share a screen that shows the table of contents for the style guide so that in case folks haven't had the chance to review it yet, we can all get to the same baseline. I think some people on this call might prefer a Spanish language version, so I apologize in advance that we're sharing an English language version here on the screen. Thanks, Mimi. So maybe can we make it a tiny bit bigger in case to help with visibility? Wonderful, that is showing everything. Okay, thank you, Mimi. So it begins with just a brief introduction stating the rationale for the style guide, which is similar to what I said earlier, just to get everybody, no, I shouldn't say just, but it's to get everybody on the same page regarding terminology and the importance of using appropriate terminology in how we speak about this project. Co-chair Glass recommended that we include a section describing context about institutional betrayal and medical trauma. And so there's a placeholder now. That section hasn't been filled in, but we're hoping that among the goals of today, at least some folks in this committee might be willing to take on drafting that section. And then in this third section, I titled it Guidance for Terminology to Use in Universal Health Plan Documents. And the terms that I offer, I suggest that we define and inculcate standardized use for throughout all of the Universal Health Plan documentations across all of the committees and across the board include people living in Oregon. We've heard terms such as Oregonians and Oregon residents, and that has different focus groups previous to this effort have reflected on the terminology being very non-inclusive. So I recommend some terminology regarding people living in Oregon. This committee can definitely alter, amend any of the suggestions that I put into this draft. So just wanted to orient people to what is included so far. Another term is non-US born persons, health insurance status, people receiving care, disability, substance use disorder, health inequities, houselessness, terminology around corrections, and relationships and partnerships. So, and then the second main section is guidance for universal health plan related messaging. And we anticipate that Patty Wentz and Diana Bianco will be able to provide a lot of guidance around how, say, we describe the plan. Mimi can probably say one of the terms that she's hoping that might be one of the adopted terms. Mimi, do you want to share what that is?
Oh, yes. So I think one of the phrases that people are talking about is instead of necessarily always saying a single payer, speaking of unified financing, which is possibly might be a more accurate descriptor of since funds, no matter what, will be coming in from different places, but it is the unification of it, which is at the heart of it. So that's one of them.
Thanks, Mimi. So that was a term, for example, that might fall under this bucket of guidance for Universal Health Plan or UHP related messaging. And finally, I am going to mention that I've worked for the state for several years now. And so the guidance that I put in here as draft form has been mostly drawn from Oregon related resources. And so in Appendix A, I shared most of the Oregon related resources that I drew from. So Mimi, can you scroll down just a little bit, maybe to page 3, so that the committee can see what is in this so far? Okay, great. Yes, if you want to stay right here, please. Thank you. So, just thank you, Mimi. To recap, the goals that I'm hoping that we can begin working on today are 1, to identify gaps in this document. So other terms and concepts that this committee believes are important to include in the style guide, which will be circulated to all of the committees and the board, and it's really going to be reflected in ideally all of the public facing documents that we share about the Universal Health Plan. Second, to recruit people to work on specific terms or sections. So please feel free to volunteer for any section or term that really speaks to you, that you feel that you have experience or the ability to help shape. And then 3, to envision ways that this style guide can be circulated throughout this project and with our partners. So those are the 3 goals. And what I wanted to show here, thank you for scrolling down, Mimi, is here is an example of what's been included so far. So again, I'm drawing this mostly from my experience as a representative, as a state worker. But for example, in the section for people living in Oregon, I recommend, and this committee can certainly change this recommendation, but I recommend that the UHP project documents use the term people living in Oregon rather than Oregonian or Oregon residents. And this particular phrase was suggested in a previous version of the Oregon Health Authority style guide. And the explanation in that previous version was that based on interviews with representatives from tribal and native affiliated groups. Those groups said saying Oregonian or Oregon resident negated the fact that many of these folks first identify with the land that they live on. So where they consider their home is not Oregon per se, but say a particular region or a particular identifier that is not Oregon, Oregonian, or Oregon resident. So that's what motivated this particular suggestion. It should be noted that the most recent version of the Oregon Health Authority Style Guide does not include this particular guidance anymore. However, partners at, say, the Healthier Oregon Project and the Real DSOG Project continue to use the term people living in Oregon. So that would be an example. Okay, I'm going to pause and return again to the 3 goals for this particular section. So 1, would anybody like to, thank you, yes, Mimi, if you could actually scroll back up to the table of contents, I think that would help. 1, I would like to open it up for discussion around, would anyone like to recommend terms or concepts that we include in the style guide? And by we, I mean the committee, because this is going to become the committee's project, I suppose we could call it, resource to create. I can't see hands, so Isabel or Mimi, if you want to
There's
moderate.
no hands yet. Yeah, so I just encourage committee members if there's particular terms that you want us to steer away from or that you want us to include, you know, we can just do a little brainstorming here just to start thinking about it. And if with the table of contents, if any of these sections are areas that you have lived or professional experience that you feel like I really want to dig in this area, you could let us know that as well. And then that will help us create kind of a work plan on, you know, if maybe there's a few people that want to dig in on substance abuse disorder or health inequities or houselessness, then, you know, we can kind of do that and then come back together hopefully next month and kind of be a little bit further in our process with this.
I'll chime in.
Yeah.
Pardon me if I missed this information while I was switching between my cell phone and my computer. Kim, I'm so grateful that you put this together. This is so important and such a great start. And so thanks. What are who highlighted the sections in it? And can you tell me more about the highlighted notes that are in the document?
Yes, Colin, this is Kim speaking. So this was a first draft. Kim Yi, highlighted the sections in yellow, meaning it could benefit from strong committee review and feedback and creation. Co-chair Amy Fellows was also able to provide feedback, and I believe Executive Director Mimi McDonald also reviewed this before we sent it out for translation. So this is definitely a draft. I thought it would help, instead of asking the committee to create it from scratch, to create at least a basic structure and put some ideas about terms in so that the committee can take it and refine it and make it wonderful.
And it's definitely something we will be looking to Shadi, I think, to help guide us on as well as soon as she's got her contract up and running.
So to keep chatting about it, it seemed like there's an ask for some input. I'm happy to give some input. I don't think that I have a specific, none of those terminologies are ones that I like have a special affiliation with that makes me more qualified or less qualified. Definitely not more qualified than other people that are on this call. I'm a person receiving care, so that's great. Yeah, I'm grateful as well for frankly, just someone's preference who is a staff member about person living in Oregon versus Oregon resident. That is really helpful. Excited to keep this conversation going. One like hope that I think we would all share is that like we'll have a little bit of grace and patience with each other, like, and with other committees, because like we're going to consistently get these wrong until we consistently get them right. Maybe, or maybe we'll just be perfect right off the bat, but cool. Great.
Yeah, and I don't think this is about like necessarily right or wrong, but more that we're all, especially when we get to the real public engagement stage, that we're all board members, committee members using consistent language with the public or with the stakeholders that we, are that we have to meet with to fulfill our task. Mickey, I see your hand up.
Hi, thank you. I'm so happy that we're developing this. It's so helpful. It brings me back to my marketing corporate days, and it was definitely helpful then. And I'm happy to review it. If you want to send it to me, I'll review and provide input. I'm also on the Oregon Health Authority's REAL-D and SOGI work group, so I'll leverage what I learned from that group. And then I'm also working on a lot of these terminology sub sections. So happy to help. Please share with me. Thank you.
Any other thoughts? And it sounds like everybody probably needs some time to kind of digest this. And I don't know, I'll kind of look to staff on what and how we can do things, before the June meeting, just so that we aren't kind of having our first real substantive conversation in June. I mean, maybe that's what we have to do, but also if there's any way to create a feedback loop as committee members review this prior to it happening real time in June. But I also want to be, recognize your staff and your plates and not volunteer you for things. So just if you have thoughts about like kind of how we can
Oh
move
no,
it
that's what we're
forward.
here for. We're here to be
Yes.
volunteered by you, and we're not
Perfect.
volunteering. Like,
Yeah.
we're here to do what you want.
And I just want to also say, Mimi, I think this is the very first community engagement and communications committee meeting that we've had an executive director.
Well,
So
I'm
it
honored,
is
honored to be here.
really great to have you here and to be a conduit between the other committees. I think we were really missing that.
Thank you. But yes, I'm just here brainstorming. It may take a little bit, and I'll work with Kim and Isabel about the best method. And it may be that we, send this out English, Spanish, and if people they can either, use the PDF and update it, or just send comments, and we can collate everything. And either depending, we can talk maybe a little bit more at our next meeting with the chairs about how that can be then shared again, and because I want to make sure that everyone feels comfortable too, because so we'll workshop that a little bit, but absolutely I think that some work can happen and people can definitely work on it individually before the next meeting.
Yeah, Colin.
Thanks. Again, thanks for saying this twice if you already said it, but who is the best person to, let's say I go through the document and I have some ideas, who is the best person to reach out to? And I think there's more conversation to be had about the people living in Oregon versus Oregon resident versus Oregonians. And I'm just curious what other people think about it. I've said all three of those phrases a lot, and but I'm just like one person, right? So definitely want to talk about that more.
And I don't know, Colin, you I think dropped off when you were transitioning, and I wasn't sure if you heard Kim's explanation of why the OHA style guide came to people living in Oregon, having to do with our Indigenous community members. So I don't know if you missed that or you were here for that and want to expand on it.
Both, and I did hear it, but it was, yeah, so Yeah,
I
so
think Kim
sorry.
is
Yeah,
gonna give an answer to that question. Just your first question, because I think it's a good one, Colin. Like,
Yeah.
who do I send this to? And I will let Kim take that one up.
Thanks, Mimi. Thanks, Amy. Thanks, Colin. So this is Kim speaking. I could see several ways for us to move forward on this. So one, today, if folks feel comfortable, they can volunteer to work on certain sections, and then we'll collectively sort of know who would like to work together on certain sections. So that could be option one. Or option two is we could send out Word versions in English and Spanish to the entire committee so that people can work asynchronously and provide their own comments or track changes to the document and then send it back to us, any of the staff members, Mimi, Isabel, or I. We work very closely, so we'll all get the same document, and then we can work on combining those comments so that we know what's happening within different sections. So that could be option number two, asynchronous work. And then I had a third option. It is totally escaping my brain. But yes, option one, have people volunteer live today to work on sections together, or option two, work asynchronously, and then the staff, Mimi, Isabel, and I can work to combine those comments into a single document that we present in the June meeting. Amy, as the chair, would you like to make a recommendation?
I mean, one thought is that when we have a weekly meeting, Michelle and I, with Kim and Mimi, that maybe we hone in on our plan at our then next Monday. I think sending it out to everybody in the meantime, just so they can start reviewing it, would be important. If people feel strongly, like, I'm very passionate about the disability section because and unless you're kind of a disability geek, you might not know about the whole kind of somewhat controversy between person first language and identity first language. And I'm very passionate about it not only being person first language, and there are still a lot of people that do identify person first, and it's always best to like ask the person. But in terms of writing, kind of the best practice that I've seen is alternating between person first and identity first. And for an example, um my teenager identifies as autistic. That's person first language, where other people who are autistic identify as a person with autism. So that's an example between person first and identity first. And the background is partially that the person first push really came from providers and parents of disabled children, but not necessarily the disabled community, if that makes sense. And a lot of people in the disabled community feel strongly about identity first. So anyway, that's just an example where I'm going to geek out. And as well as the institutional betrayal and medical trauma, because unfortunately my family has a lot of that. So yeah, I think maybe if this sounds good to people, staff send this out like tomorrow. People start chewing on it, you could let staff know, like, I really want to dig in on this section if you have that in mind. And if not, then you could just be like, I want to give general feedback. And we go from there. I mean, and we also might have people who want to dig in more after everyone's taken a first pass at our next meeting, when we have Patty hopefully guiding us also.
That sounds amazing. Thank you, Amy. I'll put that as our next step. I also want to suggest that since we want to be able to translate and repost any comments before the June CECC meeting, that we have a return timeline of 2 weeks from now. So it gives our translator enough time. So most likely everyone here can expect to see an email from Isabel or Mimi with a Word document version in English or Spanish of this draft version. And then we'll explain in the email to please use track changes for comments, and then return it to us by 2 weeks from now. How's
June
that?
11th is
June
2 weeks from
11th.
now.
Thank you, Amy.
How does that feel for folks? I see Mimi, you have your hand.
Oh, I just wanted to say, for people maybe who are not on the committee but want to give public comment, that these are also posted with the meeting materials, so people can certainly review them and more in depth than just looking at it here. So that was all.
Okay, thank you. If there are no other raised hands, thank you all for your attention to this. I'm really looking forward to seeing what this committee comes up with, and thanks for letting me propose this within your work plan. I know it's not exactly within the work plan, but your co-chairs, Amy and Michelle, seem to think that this would be a great committee to work on it. Okay, thank you. Mimi, back to you, and Amy, back to you.
So we are about 30 minutes ahead of schedule, and I don't know if people have a need for a stretch break now, or if we should just kind of plow through and finish early. Is there a strong need for people to have a short break now, or should we just move forward? I don't think the rest of our agenda items will be very long, depending on, how much outreach y'all have been doing or plan to do in the future. I have a couple things that I want to share, but sounds like we should plow through, and if someone needs to take care of their own needs, then, by all means do that. So I will just start with a couple updates that I know about. And Colin, I don't know, as a HCAO representative, if you want to let folks know about the annual conference on June 7th. I think that's the date. That's here in Eugene, where I live. Or
Yeah,
you
I
want
can.
to
Sure,
give a
I can.
plug?
Sure. The plug is that we're doing our annual Healthcare for All Oregon's a nonprofit. We have to do our annual board elections meeting once a year. And so we're doing that in the morning from 10 to 11, and then 11 till 4, we're hosting a conference about this topic, about universal healthcare reform in Oregon. We have some speakers from the governance board who are going to come. Amy confirmed last week that she's able to sit on a panel. We know that we need to keep the quorum not an issue, right? So Mary Lou, three, right? So I believe Mary Lou, who's on the board and also on the Healthcare for All Oregon board, is going to speak, as well as Bruce Goldberg, and I think you, Amy, and then Tony German, who is on the Plan, Design, and Expenditure Committee. He's also the Vice President of Healthcare for All Oregon. He's going to speak, and then I'm probably going to talk about social media and some other stuff. Yes, that's June 7th. It's free. You could pitch in for food if you want to, but everyone's welcome to attend the conference and join in on the day discussing what we're doing,
Yeah.
Yeah.
And I've gone to this most years for the last several years, 5 to 10 years, as much as I can, and really encourage people. And it's actually where I discovered Patty Wentz last June. They kind of alternate. Last June, I think we were in Corvallis, and Patty was on a panel about communication and about some polling that had happened. And the polling leads me to the other thing I wanted to share, and that I will ask staff to share in the notes. And that is that Community Catalyst, which is a national organization. I think they might be headquartered in Boston. They did a webinar a couple weeks ago, and I'll have staff share the recording and the slides. But it was focused on a healthcare survey they did with 1,000 voters from diverse backgrounds, specifically about how they felt about healthcare and government's role in it. And so it felt very pertinent to our work. It's national, it's not Oregon, but I still think there's some takeaways that we can learn from it, and just it may help spur the questions that we want to ask in some of these different stakeholder groups. Just, it just got me thinking about a lot of things. So I'll ask staff to share that with the minutes, those links. And I think that was it for me. Does anyone else have any updates about either related events or webinars that you've gone to or that are coming up that you want to share with the group that are pertinent to our work? Oh, I see Jensina and then Juan Pablo.
So I have a question. It's not necessarily an update, but I wasn't quite sure where in the agenda to fit this. But it's regarding the notification that CMS sent out today. The subject line on it is ending taxpayer subsidization of open borders. And essentially it's penalizing states that are using Medicaid funds to provide care for undocumented patients. And I'm curious how that affects, if at all, the work of the Universal Health Plan Governance Board, or if this venture is a success with the UHPGB, is this something that the state of Oregon wouldn't have to worry about at all? Because the CMS is planning to penalize about 10% of the Medicaid funds for the states that are providing services to undocumented patients.
Mimi, do you want to respond?
I will, which is I wish I had the complete answer. I do know that, and Kim may be able to chime in on this as well. I do know that our colleagues at OHA are working furiously around this very question. And I hadn't yet seen that, so that just particular disturbing announcement. So thank you so much for sharing that. And it is a little bit of, it may not alter as much kind of the sort of work that we're doing right this minute in this universal health plan. However, obviously it is affecting everyone those are living in Oregon and what is happening with OHA. And that was sort of early on when I was talking about federal waivers and how it changes a minute. This is a perfect example of that. So I think what we as staff will can work to do is to inform all of the committees, the information that we get from our colleagues at OHA and the steps that they're taking. And I know Kim was recently, maybe not on that specific topic, but on a similar topic, and might be able to add something to that conversation.
And I'll just add that tomorrow at 10 a.m. there's a joint OHA ODHS webinar on Oregon's reaction to what's happening federally. I don't know how up to date, like this just happened today, but I can make sure staff have that also, and maybe you could send that out this afternoon so people have a chance to register if they want to, because it's tomorrow at 10 a.m. I'm sure hopefully there will be a recording we can access later if you're not able to make it tomorrow. And then let's take Juan Pablo's question and then we'll see if Kim has follow-up. Juan Pablo?
Sí, primero que todo, hola a todos. Me complace informar que la organización la cual represento, estamos teniendo un gran avance en materia de educación, ya que hemos recibido un financiamiento para poder seguir facilitando educación continua a profesionales de la salud conductual en áreas rurales y tribales. Lo maravilloso de el proyecto es que ya hemos alcanzado a más de 600 estudiantes en todo el estado de Oregon. Eso es un gran paso en inclusión educativa y quería compartirlo con todos ustedes porque sé que muchos colegas comparten también la misma preocupación que nosotros por la educación. Y quería compartir eso, es un gran avance. Esperamos llegar a 1000 estudiantes que tengan acceso a educación culturalmente específica, con CUs y de calidad. Gracias y me enorgullece mucho poder ser parte de este comité y poder traer este tipo de noticias.
Thank you, Juan Pablo. Appreciate that update. Any other committee member updates before we move on? And Mimi, I'm giving you a a little reminder that you were going to look for Judy's beautiful artwork for our next conversation, just so I can stall for you for a minute.
Thank you.
Are there anyone else have any updates or questions? Like, Jensina, I think that this is a good time to ask those questions. Or Kim, do you have a response to that question?
Amy, I just wanted to add to what you said. Thank you for reminding folks that the Oregon Health Authority Federal Response Planning Team does hold those weekly webinars. A lot of their highly detailed federal response planning efforts are sort of hidden behind their SharePoint wall, and the version that they share publicly is a lot less detailed. So it could be that this committee or the board in general tries to get a seat at the table with OHA so that we can have access to those full federal response planning updates. Jensina, I imagine that today's CMS bulletin will be addressed tomorrow. That entire team is working very hard to make sure that they're up to date on everything that's happening, despite the magnitude of what is happening. So I still have access to Oregon Health Authority SharePoint because I am technically an Oregon Health Authority employee. And so if there is, I'll look into how we might see if this committee and the board's work, which is housed in a different agency, might be able to be tied into that. So thank you, Amy, for amplifying that.
Yeah, I think that is really important for us to have some kind of connection with OHA as things change every minute, every hour, it feels like. Any other updates? Oh, Colin, yes.
Yeah, I guess I want to give an update, sort of. I just learned or heard this acronym for the first time, FYSA, for your situational awareness, which maybe everybody's been using, but I just learned it. So for your situational awareness, Healthcare for All Oregon has a social media presence that has sort of like a slow burn of people learning about the work of the governance board and the ways in which to engage with them. And so I think that there's been a bit of a funnel, but so that spark has been sparked, or whatever you want to call it, and there's like a slow increase of interest. So that's one thing to be aware of. And then something else on the Healthcare for All Oregon front is we're increasing what we're calling our community conversation groups. So I went to speak at PSU last week about, my personal opinion, and then also pretty sharing information about the governance board at Lavinia Goto, who is a professor of health policy, and I encouraged her to apply for a board position. So I don't know if she'll get around to it, but anyway, so Healthcare for All Oregon will be speaking sort of around the state as we're invited to different locations about the work of the governance board. It'd be great if we had 100 on the docket, but we have like 4 now, but that's something that we're doing. So.
Thanks, Colin, and thank you for the reminder. Mimi, do you want to share with folks the that we do have an open board seat? And I know it's you can explain the health provider role. I know it's not a community seat like mine is. It's more specific.
Right. No,
If you want to
thank you
share,
so
just so people know, and maybe they can share it with folks or put it on their LinkedIn and that kind of thing.
Yeah, absolutely. Thank you so much. Yes, there is an open UHPGB board seat. It is slated to be someone involved in healthcare, but that's a pretty broad category. So it doesn't necessarily mean someone who has been a specific provider of healthcare. It could be people, it could be healthcare policy people. It could be all kinds of, definitely, I know that, that people who are involved perhaps in the more the business aspect of healthcare. So just so people know, so it's very broad. If a person has already applied to in the past 2 years, their application is actually evergreen, but they would need to just shoot us an email or something and let us know that they are interested again. So that is one important thing. Two, if you go onto the UHPGB website, there's a little banner there with a link for how you can apply as well. And so I would say that we have not had a robust response, so the more the merrier. We would love it to, tell your friends and neighbors and people who are passionate about this work. That would be tremendous. So thank you so much for reminding us of that.
And can you remind kind of the deadline for applying and
Oh,
then the
yes.
timeline with the governor appointment? And because it kind of
Oh, yes.
is not
It
what
does.
people.
No, it does take a minute. The timeline just to put in an applications have to be received by June 20th. So not too far from now. So it's coming up. The actual appointment process doesn't happen until September. So basically the board folks review and then they put forth a couple of names to the governor's office, and then the governor then will make a decision about who that appointee is. So, yep, takes a minute. But yes, please spread the word. I appreciate that. Okay, I found the slides. Thank you, Amy, for giving me the lead time. Are we getting there? Sorry, I've had
Now we
the
see it.
Dallas is having some Wi-Fi moments, so my apologies. So I will just kind of briefly state this is, as I mentioned, kind of the first sort of poster had this, and I apologize because this is probably too small for people to read super well, but that Judy Richardson had created and kind of talking about these different values, and had sort of worked on a sort of a mission statement. And what I really came to me is that I think that there was a lot of a discussion around, yes, this is great, and we really want to center the person receiving care, or the people need to be sort of a bigger part of this. I don't know if that was, Amy, if that was your memory, or
So
Tim
this
or
is very
Isabel.
much not settled in terms of the mission, and I think our kind of it was towards the end of the meeting that we were like, this is too system focused. We kind of need to flip it on its head and have it be person focused. But we have not met again yet to kind of dig in and do more of that work on the mission statement. But yes.
I'm just laughing because I can see all Oregonians that's scratched out Oregon residents. And so they haven't read the style guide yet. So you all have to finish that. But yes, it's very true. This is very much a draft. But yes, you can get a sense of Judy Richardson's amazing artistic abilities. And then I will go on to the next one. Oops, sorry. Come on. Again, apologies for my atrocious Wi-Fi. Oh dear. There we go. Oh, it was too much. Okay, I will stop now. Hopefully y'all can see it. Maybe Amy, you can do it.
Yeah. So the current state is kind of the mess we're in now, for lack of better words. And then there are some things that are a little bit cut off at the bottom, but you'll see some sharks in the water at the very bottom. And there's kind of this cliff. Oops, it flipped back, Mimi. There we go. So there's things kind of falling off the cliff into the water in our current state. And I'm trying to remember exactly. I know that the oval shaped items at the bottom are those stepping stones that Mimi referenced. So things that could be being worked on while we get to our future state, or or maybe like interim process type of focused work. So those are things that the various committees may be working on, or but at the same time, it's important that we don't like kind of go down a rabbit hole and get into side projects that are as big as our our main project. But that's kind of the idea of those stepping stones. And then I'm trying to remember, Mimi, the kind of, it's not really a rainbow arc, but the kind of upper arc bridging between current and future, how we described
Yeah,
that.
I
Were
think
those
I know it's not quite process steps, but a little bit of like, this is part of the process will include this work that is ongoing.
yeah. And then in our future state, kind of the main takeaway, a functional system that can be equitably, reliably accessed and does not cause harm when and where people need it, excellent health outcomes, simplicity as much as possible, um, lo- lost control and not profit driven, success is measured one way. I'm not sure, I don't remember exactly what that was. Transparency about cost and outcomes, so that it's not like this black box that we live with now where, you know, one hospital can charge one thing for a hip replacement while another one charges another, even if they're across town from each other. But nobody really knows until they get the bill and actually like what is the actual cost to do that work. So yeah, this is just to give you a flavor of what we discussed in that 9 to 2 strategic planning process, and it was really helpful. And I know that we came away, I think it was on a different sheet of paper, but it might be some of the things that are in that upper right corner in green that um there are things. Oh yeah, there we go. That's what I was trying to get to, the things that kind of were our takeaways that we're going to be discussing at future board meetings, and kind of getting focused on. So Mimi, I don't know if you have anything specific to say, because I'm not sure, you know, Mimi meets with the board chair and co-chair, where I am not necessarily always there, so I don't know if any planning has happened
Yeah.
on kind of our next steps for the next meeting.
Yeah, I would say definitely at the next board meeting, that's going to be built into the agenda, you know, kind of discussion of some of these sort of bigger issues, like how will this regional, you know, what do we mean exactly by a regional entity, or more, you know, sort of broad strokes, but, you know, what is the payment model? How do we decide upon that? So sort of bigger issues that then will allow the committees to refine their work even further. And sorry, yeah, this is definitely a little messy. This is Judy Richardson going through it at the end. I think people may or may not have been losing a little bit of steam towards the end.
So that just gives you all a little flavor of our strategic planning session and kind of how we're going to tee up work for the next few months. And I don't know if folks have any questions for us about that after seeing the visuals, or if there's other kind of just reflections on today's meeting or topics you'd like in the future. Yes, John.
Amy, I just mainly had a question about just a fine detail in the second graphic that you shared, language around global budgets for hospitals, and then global budget was also kind of in the end state. Can you talk a little bit about what that might mean in real terms or for stakeholders?
I'm gonna let you take that one,
I
Mimi.
Yeah, absolutely. I can talk a little bit about that. And I want to just be absolutely clear. This is definitely a brainstorming session. So it's not that these have been completely defined. So global budgets being, for example, let's just say for a hospital, that there would be usually a defined amount that basically, all right, this hospital gets whatever, $100 million to take care of this population, and that is their budget. And of course, it's not like someone is just randomly picking things out of a hat, but that is something that is being brought up more and more as hospitals are just, especially smaller hospitals, are struggling with being able to stay afloat, and then having that knowledge that there will be, you know, X amount of dollars, and then it can also alleviate some of the discrepancies of cost shifting that you guys, you know, are probably well aware of. In other words, that Medicaid pays less than Medicare, which pays much less than commercial. So essentially, you know, commercial plans, and or which really means commercial people who have commercial insurance end up paying much more for the same thing. That's another one. So a little bit about that. So that is, I would say, one of the sort of bigger things that is up for discussion in finance and revenue, and in operations, and in plan design and expenditures, is all kind of rolled in there. And that's definitely, other states are looking at that as well. So.
Any other thoughts or questions about what was just shared, or about today's meeting? More thoughts about moving forward with our style guide or future meeting topics? Go ahead, Mimi.
I just had one about a future meeting to check back in with you, is that the time of the meeting on June 25th.
Oh, yes.
The start time.
Yes, thank
We're
you for reminding me.
proposing that it be changed, instead of at 1 o'clock to 1:30, to give our tremendous chairs at least a chance to breathe, I think, between meetings. I'm not sure.
Yeah, so yes, that day, so my organization, We Can Do Better, has our Allies for a Healthier Oregon end of session debrief that we do. That's a little bit longer, kind of more eventy meeting. And once we get our event right, I will share. So if any of you are interested in hearing a end of session debrief, you're welcome to come. But we're looking at doing it at 11 to 1 p.m. that day, because we already meet on Wednesdays at noon, but just extending it on the front end. So just to give Michelle and I, and Michelle's part of that meeting as well, a minute to breathe, we were hoping to do a 1:30 start on June 25th. And I don't think we need to extend the end. So just wanted to give folks a heads up about that, or see if there's any concerns. Great. Any other thoughts? I think so. We have some follow-ups from staff. The one thing that we for sure want to get sent out today is the OHA ODHS federal update. Kim, do you have access to that link? If not, I can send it after the meeting. You got it. Okay. So we'll want to make sure you guys get that right away. So if you want to sign up to join that at 10 a.m. tomorrow. And then we will also share that Community Catalyst webinar that was mentioned. And I also can send staff, either Colin and I can send staff the link to the HCAO annual conference if people were interested in participating in that. And Colin, is there a hybrid option for that this year? I recall last year they did hybrid.
Correct. Yep.
Okay, there's.
Yeah, and Amy, if you're fine sharing that link, I'd appreciate it. That sounds.
Yeah, I can do that.
I had a question. I didn't parse through all of the meeting materials, but I was just looking right now, and I heard the discussion about the change in timeline. Is there any documentation about the change in all of the different committees' timelines, or can you speak a little more to that?
Absolutely. So kind of just like I made a little semi Gantt chart for you all in your committee, we're making them for all the other ones too. So that's a great question, Colin. I did have a master one that is very colorful and exciting, but not quite up to date yet. So I will trying to find a better way to share that. I mean, and I can, you know, without everyone having to be forced to go through every committee's link. So I'm going to work on that and try and find a good spot for it. Essentially, we're again, because staff turnover, a little bit delays getting some consultant groups on board. couple 3 to 4 months, but we're still on track for September of 2026. So that's sort of the important thing. So, or one of the important things. But I'll work on figuring out a better way to have that available.
All right. I think if there are no other questions or comments, it sounds like what Colin just raised, maybe we can add as a future agenda item to have that kind of master look. And I think we can move to public comment now. I don't know, Isabel or Kim, do we have people signed up for public comment today?
I believe there was one public comment submitted. I don't know if we want to read that in the meeting.
Oh, it was a written public comment. Is there anyone that's here to give one today that signed up?
Yeah, we didn't receive any requests to provide public comment.
I'm
I think
wondering.
Lou Sanu has a
Yep.
hand up.
Okay, yeah. Lou, are you wanting to give a public comment? You're on mute.
Uh,
There you are.
all right. Thank you. I got my requests in, I think, a little bit too late. I am really concerned about this subcommittee. It doesn't seem to be getting everybody involved. Meetings are kind of, you know, meetings should be a reporting kind of thing, and the work is done before the meeting. I'm hoping that maybe um, y'all can delegate the work out so that you have things to report. I'm very pleased about the style guide. It's a funny name. People living in Oregon seems like a good phrase. I was a little bit concerned about non-US born. I don't know where all that goes because there are many naturalized. I have many friends that are naturalized citizens. So anyway, I wish you all the good luck in the world. I I keep thinking that this committee will engage the public and figure out ways of how to engage the public. If I'm wrong about that, I, I apologize. But it seems like it would be a good idea if you are going to engage the public, is to identify those groups that need to be uh, opened up with need to have a conversation with of their concerns. One of the concerns I have, and I raise it every chance I get, is that there are many union members in this state, 270,000, and counting their spouses and family, that's probably 500,000 voters. There's a portion of the union group that is not public employees, but private, and they're employed under multi-employer contracts. These people will have many concerns that this committee and the governance board should hear about to get them on board. So a warning to, thanks for letting me chime in here. Oh, by the way, before I go, it'll be our guest speaker at the conference, HCAO conference, will be Michael Lighty. He's the president of Healthy California Now, and they are a group much similar to Healthcare for All. So it should be interesting to find out how far along they are and how comparable we are. Okay. thank you again for letting me speak.
Thank you, Lou. And just a reminder, Michael Leidy came to our committee, I think,
Yeah.
was it 2 months ago? So yeah, so will be great to hear from him again. Thank you. If there's no other public comments, I think we can adjourn for today. All right. So you will be getting some emails from staff. Watch for those about opportunities to engage, to check out that community catalyst polling that was done, and also to start digging into the style guide so that we can really focus in on that next month. Thank you, everyone.
Thank you.
Everyone, goodbye.
Thank you, everyone.